Hi, hello. Today we are going to see about jugular venous pulse. Jugular venous pulse means height of the vertical column of the blood above the sternal angle at 45 degree. Internal jugular vein is taken as it directly reflects the right atrial pressure. Elevated JVP means more than or equal to 3 cm of H2O. So coming on to the waves, A, C, V waves or positive waves, X1, X2, Y waves or negative waves. Coming on to what they represent, A wave, right atrial contraction, X1, X2, right atrial relaxation, C wave, the upward tricuspid valve bulge, which coincide with S1, V wave, atrial filling, which coincide with S2, Y wave, atrial emptying. As you know, atrial emptying means ventricular filling, which occurs 70% by the passive process and 30% by the active. Coming on to the waves and abnormalities, first wave, A wave, which is prominent in the case of tricuspid stenosis, pulmonary hypertension, and right ventricular hypertrophy. Giant wave, which is known as Cannon, will be seen in AVNRT, junctional rhythm, ventricular tachycardia, AV dissociation, complete heart block, absent the case of atrial fibrillation and hyperkalemia. X wave will be prominent in cardiac tamponade, restrictive cardiomyopathy, and constrictive pericarditis, and it will be absent in the case of tricuspid regurgitation and RV failure. Coming on to V wave, V wave will be diminished in the case of hypovolemia and prominent in the case of increase in vena cava pressure and chronic constrictive pericarditis, right RV failure, and second root in the case of AST and tricuspid regurgitation. That sign is known as Lancy sign. Prominent V wave will be tricuspid regurgitation. Y wave will be prominent in the case of chronic constrictive pericarditis, low in the case of tricuspid stenosis. And coming on to Kussmaul sign, normally JVP will drops with inspiration, but when it increases with inspiration is known as Kussmaul sign. Will be seen in the case of chronic constrictive pericarditis, restrictive cardiomyopathy, right ventricular MI, tricuspid stenosis.